In this age of hypermedia scrutiny, almost anything is fair game when it comes to delving into the lives of political candidates. But what about their health histories? Should they have the same privacy protection as the rest of us? Or does their run to lead the country legitimately open their medical charts to the world? Hi, I'm Dr. Dave Campbell with the medical and health implications about recent political news, this time on the most recent medical disclosure from the current presidential campaign trail. Donald Trump, from my hometowns in Palm Beach County, Florida and New York City, through his personal physician, Dr. Harold Bornstein, became the latest candidate to join Hillary Clinton, Jeb Bush, and Chris Christie to trumpet his, and I quote, astonishingly excellent health, as he further bolsters his bid to become President of the United States of America. In an open letter to the press and every household in America, Dr. Bornstein wrote, "If elected, Mr. Trump, I can state unequivocally, will be the healthiest individual ever elected to the presidency." Wow, just because I am a doctor myself, and just because I have had the privilege of meeting Mr. Trump in person at his home in Palm Beach, Mar-a-Lago, I'm not an expert on Mr. Trump's health. But he's always looked healthy to me, vibrant in fact. And most telling, the confirmed fact that he does not smoke or drink alcohol is one of the most important bits of health history that lead credence to his state of amazing health. Dr. Bornstein's letter has few details, but the fact that one of the healthiest, smartest, and most influential heart surgeons in history, Dr. Michael DeBakey, never had time to exercise and lived to a ripe old age after making some of the most scientifically groundbreaking advances in his field, it puts Mr. Trump in good company. And Dr. Rand Paul, an ophthalmologist, and Dr. Ben Carson, a neurosurgeon, both look pretty darn healthy to me also. The bigger issue concerns physicians climbing on the campaign bus with their candidate patients to press what is a more political rather than a medical opinion. To be sure, there have been previous high-profile cases for presidents in the past of less than full medical disclosure. John F. Kennedy was viewed as a vigorous and vibrant 43-year-old. JFK suffered from hypothyroidism, Addison's disease, and severe back pain from an injury he sustained during World War II. Woodrow Wilson had a history of stroke prior to entering the White House, and Franklin D. Roosevelt suffered from advanced heart disease and high blood pressure. All of those presidential conditions flew below the radar while those men served in the United States in office. Of course, that was before the internet and social media. While there have been calls to have candidates undergo independent medical evaluations similar to those given to pilots and military personnel, and arguments on both sides of the issue, I suppose the best approach in dealing with the medical disclosure of political candidates is to take them at face value, but with a healthy skepticism. Fortunately, being commander-in-chief takes more brain power than brawn. I personally do not care if my president can run a mile or do 20 push-ups. I want my president to lead our country to safety and prosperity in these difficult times. I will leave the physical fitness to my son in the United States Marine Corps. Thanks, Dr. Dave Campbell.